The treatments I got, they're toxic to the heart, and there's a group called the International Cardio-Oncology Society. And these are cardiologists who are interested in figuring out that some of the chemotherapy drugs are actually damaging the heart and how can they prevent more cardiovascular problems. So anyway, I'd asked my oncologist, I said, look, I was a runner my whole life, I got a really strong heart, can I take more chemotherapy? And he said, no, we just don't do that. And a lot of the studies are based off average cancer patients. And granted, there's a big difference between sports performance research and cancer subjects. You know, vast difference between the athletes. But I look at it as an athlete like, well, how can we use all this stuff we learned in exercise sports science in oncology? And I asked, can I take more of this drug? And he said, well, we just won't let you do that. But they don't really know, you know, can somebody who's been an athlete. But there have been some studies that if you exercise, you give more protection for the heart against some of the drugs that are bad for the heart that you get during chemotherapy. So right away, these cardio-oncologists, they're interested in it as well. And that's one of our scientific advisors. He was involved in one of those studies, that it actually protects the heart. And I went back and looked at all the old exercise research, and that even if you stop exercising, you know, maybe a couple of months, the benefits, if you've been a lifelong exercise, you still have all these higher enzyme levels, 40% higher than somebody who's sedentary. So that, well, that alone even provides you some benefit. So if you keep exercising before your first treatment, it might even be better. But again, no one's really gone in and just specifically studied that, and or done it well enough. So that's a lot of, I mean, again, as I said, I was really surprised that they weren't further along in exercise and oncology research. And again, it's just because they kind of forgot about survivorship studies. And so I said, well, we just kind of need to move this forward because we think it'll, you know, prevent cardiovascular problems with some of the drugs. But also we hope that it'll actually improve the treatment so people live longer, less side effects. You know, they just don't know yet. So a lot of the questions you ask him is that, yeah, they just don't know. And it's really common for exercise not to even be brought up and mentioned with cancer patients when they go through chemotherapy. And I'm just stunned. You know, there's a lot of research out showing that it benefits, but it doesn't get all the way down to the clinical practice between the oncologist and the patient. And I'd like to see more of that happen.